Hello, this is Dr. Wells with Wells Medicine, and this is going to be a super squishy discussion. So if you're not into woo-woo, definitely find a different video. One of the things that my patients talk about all the time is the different colors that they see during infusions. Some people see very dark purples, almost into blacks. Some people see bright lights. Some people see black with stars almost in them. Some people see greens and pinks and a lot of like purples and a lot of like pinks fading into purples. And the colors, if patients are very visual and having these color experiences, can change during the infusions as well. So sometimes during the beginning of ketamine treatment, patients will feel like they're seeing a little bit more black, a little bit more darker colors, and it'll fade over the course of several treatments into like lighter colors, pastels, pinks. Sometimes I'll even see this echoed in the clothes that they wear. So they'll come in and maybe they're wearing very dark clothes, sometimes black clothes, and then over the course of treatments, they're wearing some whites, some lights, some pastels. Sometimes you can kind of see it in their choice of makeup as well. I had one patient tell me she felt like it was aura cleansing, that she was going from dark things to the lighter colors. I don't know very much about auras, so I can't speak to that. But a lot of patients will describe sort of halos around different people in the room or different objects. Those colors tend to be pinks and pinks into like purplish. And some patients will have very vivid naturalistic colors. So like green, but it's trees growing, or pink, but they're fluffy pink clouds. But some patients will just have blobs of color moving around. Sometimes it'll be in patterns, and sometimes it'll be, around objects, and sometimes it'll just be flashes of the color or movements that kind of hint at color for them. I think it's a very interesting kind of correlation between whether they perceive those colors as healing or healthy. But some patients have even had those colors and just have no context for them. They're just like, "Ah, it was all green today," or "Oh, it was all pink today." For my patients that really believe in auras or color healing or crystals, a lot of times when they bring in that sort of crystal or the color perspective, they can create more of those colors during their infusion if they're trying to. So I think that's really interesting because, we can all create colors when you push on your eyeballs gently. You can create some flashes of light in there as the optic nerve is perceiving things. But it's really interesting to think about what the optic nerve is doing during a ketamine infusion. And sometimes the colors will correlate with the music choices, which is in medicine, we call that synesthesia, where one sensory organ will kind of pull in or affect or tug on another one. So colors create music or smells create sounds. But that synesthesia is really interesting and kind of appears like the whole brain is doing something during a ketamine infusion. So that's just a little bit about ketamine infusions and different colors. There is no right color. There is no wrong color. One funny story is I had a patient who really never changed off black. And she came to me for several visits, and towards her sixth visit, I was like, we talk about how you're feeling a little bit better. I've noticed that you really are still wearing only black clothes. And she was like, oh, I used to be a model, and this is we always wear black. It's just the most flattering color. I don't even think I have any other clothes. So, sometimes it's not always the case, but lighter colors, lighter clothes, and I think changes, looking for those changes in colors as you go through the process of a ketamine infusion can be really interesting idea of what's going on in the brain as well, and maybe even aura cleansing. So if that kind of floats your boat, looking for those different colors and what those different auras mean can be really interesting as we're moving through the ketamine treatments.